morning, everyone. Our chapter today is about effect of dosage forms on drug absorption. You know the different dosage form like tablet, capsules, that's the solid dosage form, and we have liquid dosage form like solution and suspension and emulsion. So which of them is faster, which of them is slower, and also we have the semi-solids, creams and ointment. Which of them will have faster absorption rate and higher extent, which of them will have slower absorption rate and lower extent. That's what we will understand in this chapter. We need first to understand the function of the dosage form and its importance. The dosage form should contain the labeled amount of the drug, which is the dose, 50 milligram, 100 milligram, and so on. And it should be also suitable for administration. If we are giving the patient injection, so it should be in the form of solution or suspension. If we are giving the patient, for example, by nasal route or something by ocular in the eye, so in this case it should be eye drops or nasal drops. If we are taking something oral, it should be small enough to be engulfed. It should be also acceptable to patients. Many patients hate injection and hate suppository, so we need to avoid as much as possible injection and suppository. It should deliver the drug to the site, from the site of administration to the blood by the maximum possible rate and maximum possible extent to ensure that the drug is really effective. So mainly in this chapter we'll study three sections, mainly the effect of dosage form itself, the effect of the excipients present in each dosage form, like the diluent, lubricant, and all other excipients that we will learn soon, and also the manufacturing process, how we are manufacturing the tablet, how we are making the solution or the injection. Also, the method will have an effect on absorption. So start with the first one, which is the effect of dosage form. So here in this graph, you can see that if we have a tablet, the tablet should disintegrate first and form granules, which is a coarse particle, very big particle size, and then these granules will disintegrate more. Part of each granule will dissolve and it will disintegrate more into fine particles. And this fine particle will continue dissolving till it becomes completely in the form of solution. Nothing could be absorbed before the solution. So the tablet should disintegrate, that is the first step, and the granule will disintegrate more. It means break down into smaller and smaller fine powder, and then the fine powder will dissolve to form a complete solution. In this case, the drug will start to be absorbed from the small intestine to the blood. So how much time it will take, we don't know. It may take 20 minutes, it may take half an hour. If we are comparing tablet with suspension, you can see that in case of suspension of course is a liquid dosage form, contains a powder already, is a fine powder dispersed in water, so no need for the suspension to disintegrate into granules or for the granules to disintegrate into fine powder, because the suspension itself has fine powder. So this fine powder, once it is administered in water, it will start to dissolve. So now which one is faster, suspension or tablet? You will find that suspension is faster because it doesn't need to disintegrate. First step in suspension is dissolution. If you compare tablet and suspension, again is solution. In case of solution, no need for disintegration, no need for dissolution. Already the active ingredient is dissolved inside the solution. Once it is administered, it will start absorption very fast. So from this slide, we can summarize that solution is faster than suspension, and both of them are faster than tablet in terms of rate of absorption. To understand more in this graph, we have four lines. The first one is aqueous solution. This one is aqueous solution of phenobarbital. All of them are having phenobarbital. 3 or 4 different dosage forms. The second one is aqueous suspension. So this one is aqueous suspension. And this one, the third one, it is written here, it is a tablet. And number 4 also is another tablet, but the difference between them that this tablet is composed or containing sodium salt, phenobarbital in the form of sodium salt, while the last one, it has phenobarbital in the form of acid without sodium. So which one is faster here in absorption? That is a plasma curve, plasma concentration curve. So this 4 dosage form already administered by 1 or more patients, and we are taking sample from plasma at different time intervals. So which one is absorbed faster? Which one went up faster? You can see that the fastest one is aqueous solution. The second one, or the next one, which goes up and down, the second one is suspension, and the third one, this one, is tablets that contain sodium salt, and the last one is the tablet that contains the acid. So again, we know that solution is faster than suspension, and that is a confirmation. Suspension is faster than tablet. But here we have 2 types of tablet. One contains sodium salt, which is more ionic, so it will dissolve faster and absorb it faster, regardless of the other factors. They tried this one, and they found that the ionic phenobarbital sodium, here the solution, has a great effect on absorption. And the last one, which is in the form of acid, weakly ionized, so it affects the solution, and so if the solution is less, absorption also will be less. Although it is non-ionized, but again, as we said before, non-ionized is good for absorption, but it should dissolve first. So here we'll start in more details talking about each dosage form. For example, solution. Solutions are required for young and elderly patients. If the patient cannot take tablet or cannot take capsule, so it's better to give him a solution, aqueous solution. And widely used and commonly used in case of cough and cold, especially in kids and newborn patients. Absorption, of course, is immediate, very rapid, and almost complete, because the main obstacle against absorption is dissolution, and already the active ingredient here already dissolved. Most drugs, as we know from the previous chapters, most drugs are absorbed from which area? From the small intestine. Because of what? Because of the large surface area, the cells which is more appropriate for absorption. It is absorptive cell. There is no thick mucous membrane, as we said before. The residence time is more, up to 5 hours. So the rate limiting step for aqueous solution is just to move from stomach to small intestine. If something is retained in the stomach for a long time, retained here in the stomach for a long time, this will delay the absorption, because most of drugs are absorbed mainly in a small intestine. Few drugs are absorbed only from stomach. Okay, with more details also, if we have an acidic drug like phenobarbital and you want to increase its absorption, its dissolution and absorption, we can convert it into salt. So we'll make it phenobarbital sodium. But after administration inside the stomach is containing HCl, very strong HCl. So HCl will interact with phenobarbital sodium and precipitate phenobarbital again. So it will make sodium chloride. It will take the sodium from phenobarbital, and phenobarbital acid will precipitate. But it will precipitate as fine powder, which will take its time to dissolve again, but at the end it will be better than administering phenobarbital from the beginning. So it will be faster in dissolution to take coarse powder of phenobarbital. So this precipitate is usually finely divided powder with large surface area, as it is written here. So it will be easily redissolved and better than taking phenobarbital as a weak acid from the beginning. Also, if you want to increase solubility of drugs, we can add mixed solvent. So in addition to water, you can add a small percentage of alcohol, or better to add glycerol as co-solvent to increase the drug solubility and make sure that the drug is completely solubilized. We can add something also to increase viscosity. Why we need to increase viscosity of solution? Increasing viscosity will improve pourability. For example, let's imagine that we have a bottle of non-viscous liquid, and you want to take 2 milli in a spoon here. This is a spoon, and you want to take exactly 2 milli. If the liquid is not viscous, once you tilted the bottle, the liquid will jump very fast from the bottle to the spoon, and it will be difficult for the patient or for parent of any kid to adjust the volume at 2 milli. But if the liquid is little viscous, not much viscous, if the liquid is little viscous, it will go down slowly, so it will be easier to adjust the volume at 2 milli. But of course, if the viscosity is very high, as you know from physiological factors affecting drug absorption, it will increase the viscosity of the stomach itself. And if the viscosity of stomach content is higher, this will make what? This will decrease the gastric emitting rate and delay absorption. And again, you know that absorption is mainly from the small intestine. So if the stomach content becomes very viscous, the gastric emitting rate will become less, the drug will remain in the stomach for a long time, and this will delay the drug absorption. So again, the major problem of the solution is not about absorption or dissolution, because it doesn't need to dissolve, it is already dissolved, and once it is dissolved, absorption is easy. And we said once it moves also from stomach to small intestine, it will be absorbed. But really, the major problem before administration is chemical stability of the active ingredient. The active ingredient should be stable in water. If the active ingredient is not stable in water, we have to make this drug in the form of suspension, in the form of tablet, in the form of anything. And one clear example of chemical stability of drugs in water is aspirin. Aspirin is not present in form of solution, it is only tablet, because aspirin is acetyl salicylic acid ester drug. If you kept it in water, within few hours or days, it will be completely hydrolyzed. The second dosage form is suspension. You know, suspension is powder dispersed in water. That is the aqueous suspension. So the rate limiting step for this powder is to dissolve. As we mentioned, no need for disintegration. It needs only to dissolve. And usually it is finely divided powder or very fine powder, maybe 1 to 10 micrometer or 5 to 10 micrometer. So once it is administered, dissolution is not taking long time. It has rapid dissolution, and once it dissolves, it will be absorbed. But we need sometimes to add surfactant. Surfactant in suspension is not to dissolve the drug. It is mainly to improve dispersion and make the powder well dispersed. Otherwise, if the drug is very hydrophobic, it will float over the water like that. Even if you mix, the powder will jump and float over water because it is very lipophilic or very hydrophobic. It hates water. But if you add little amount of surfactant, the powder will become dispersed. And even after you leave the bottle for a long time over in the pharmacy or over shelf, so when the suspension precipitate, surfactant is very important to prevent caking of this powder. So without surfactant, the powder will stick to each other and form a cake which cannot be redispersed by shaking. And here we have a comparison to show the effect of particle size on bioavailability of suspension. Here we have two dosage form or two suspension of phenytoin. Both are suspension, but one of them is normal suspension or conventional suspension, and the other is micronized. So, of course, the fastest one is the micronized one. It is written down here. G is the micronized one. Micronized, it means that the size is very small in the micro range, maybe from, as we said, from 5 to 10 micrometer, while the conventional drug may be much bigger than 10 micrometer, maybe 500 micrometer or 200 micrometer. This is the conventional size, which is very big. You can call it also as coarse powder or coarse suspension because it is big in size. So if you compare between the conventional suspension and the micronized suspension, you will find that the bioavailability, the rate of absorption, and maybe the extent also of absorption of the micronized suspension is much better than the conventional suspension. Let's go to the next dosage form, which is about capsules. And here we need to recognize or differentiate between the hard and soft gelatin capsule. This one is hard gelatin capsule, this one is soft, and this one is soft gelatin capsule as well. As you see, this one is oblong, this one is oval, but this one also is oblong. Okay, so the difference between the hard and soft gelatin is not in the outline, not in the shape, because here we have hard and soft gelatin capsule and both are oblong. So how to compare between them, how to identify them if you are standing now in a pharmacy? When you see that the capsule has two portions, one of them is called body and the other is called cap, that is hard gelatin capsule. But when you see that the capsule is one piece, you cannot differentiate, you cannot open it, and it is 99% filled by liquid, that is soft gelatin capsule. So when there is no body and cap, even if it is oblong, that is soft gelatin capsule. But actually the difference between them in the composition is how much glycerine and gelatin present in this capsule. In the hard gelatin capsule, it has more gelatin and less glycerine and water. That is why it is hard. This soft is the opposite, has less gelatin and more glycerine and water. But of course, you cannot recognize that, we cannot differentiate between the amount of gelatin and glycerine from the shape only. From the shape, you can identify if there is cap and body or there is no cap and body. If there is cap and body, it is hard gelatin capsule. If there is no cap and body, it is soft gelatin capsule. So here, the hard gelatin capsule, if you start talking about it, it dissolves very fast inside the stomach, inside the whole GIT content, but mainly in the stomach, because gelatin hydrolyzes very fast in HCl. Which is faster, capsule or tablet? If you compare between, that is a tablet and that is a capsule, body and cap, this capsule filled by powder, fine powder, while in the tablet, the powder is compressed under very high pressure to form this tablet. So which one needs disintegration? Of course, the tablet needs disintegration. Disintegration takes up to 30 minutes, while dissolution of the capsule shell and releasing fine powder inside the stomach take up to 5 minutes. This one takes 30 minutes to form fine powder. The tablet takes 30 minutes. So which one is faster? Usually the capsule is faster because the capsule is having fine powder and this shell takes very short time to dissolve, while the tablet to disintegrate into granules and the granules into fine powder and the fine powder to dissolve, it takes long time. So usually the capsule is faster than tablet because the tablet there is higher compression force and it needs time for disintegration. Inside the capsule we need some excipient. For example, if the active ingredient is very hydrophobic, we can add a surfactant. Of course, it is not needed inside the capsule, but it is needed inside the stomach. When the capsule opens inside the stomach and release, this is the capsule, but inside the stomach it releases the powder. If this powder is very hydrophobic, it will not dissolve. So we are adding surfactant as a wetting agent or dispersing agent for the active ingredient, not in the capsule because the capsule is already solid dosage form. We need to increase dispersion of the active ingredient inside the stomach and facilitate its dissolution inside the GIT generally, not in the capsule. On the other hand, we have the soft gelatin capsule, mostly or 99% filled by liquid. Very few examples that you may find it filled by suspension or paste. Paste is something semi-solid, similar to the cream, and maybe filled by dry powder. But 99% filled by liquid, and this liquid should be oily liquid. It cannot be aqueous liquid, because if you fill the gelatin, mix of gelatin and glycerine, if you fill it by water or something aqueous, drug dissolved in water, the water itself will dissolve the shell. before administration. So you cannot fill it by aqueous preparation. Usually you fill it by liquid and oily liquid, and this oily solution or oily liquid, usually oil soluble vitamin K and E and D and A. Okay, this soft gelatin capsule dissolves faster than the hard gelatin capsule because already it has more glycerin and more water which facilitate its dissolution. It is already softer than the hard one. The hard one contains more gelatin. Gelatin takes more time to mix or to hydrolyze in HCl. Disadvantage of this soft gelatin capsule that sometimes the drug inside the capsule sometimes precipitate inside the capsule. During shelf life, during storage in the pharmacy, it may precipitate inside the soft gelatin capsule. And also, if we have deliquescent material inside the capsule, it may take moisture from outside, or it may, of course, here it is closed, so it will take moisture from the shell itself. So the content inside the capsule, which is deliquescent, the word deliquescent, it means very hygroscopic. And what is again hygroscopic? Hygroscopic, it means the powder has affinity to take moisture from atmosphere. Take moisture from atmosphere and become sticky, while that is hygroscopic. So what is deliquescent? It means take much moisture from atmosphere and it may dissolve in it. So it's taken very big amount of moisture up to the extent that it may dissolve in this moisture and form a solution. So if this soft gelatin capsule is filled by powder and this powder is deliquescent, the powder will try to take moisture from outside, but of course there is no outside here. It will take from the shell itself. Once it takes from the shell will become dry and brittle, hard and brittle. Brittle, it means easily broken. When the patient is trying to take the capsule from the blister, it will be broken and open in his hand instead of taking it as it is. And of course, it is more expensive because the machines used in manufacturing of soft gelatin capsule is more expensive than the hard gelatin capsule and more complicated as well. Then our next dosage form is about coated tablet, and the word coated tablet here, it means the active ingredient is present inside, maybe mixed with lactose, and the whole tablet is coated by another layer, another polymer or substance. This coating may be to hinder or to mask the bad taste of the active ingredient and the tablet excipient, maybe to give good appearance to the tablet. Maybe the active ingredient itself has a color like brown color and the excipient are white. So without coating the tablet, the patient that may feel that this tablet is having a problem, having a fungus or having something with green color, spots of green or brown color. So to mask all that and to have a good appearance, we can coat all this excipient and drug with a polymer which may be having a shiny color, yellow or red color. And also sometimes the active ingredient is sensitive to moisture. Maybe the powder is hygroscopic, as we mentioned a few minutes back. So when you cover it with a polymer, it will protect the active ingredient during storage and protect the whole tablet from moisture. Disadvantage of having a tablet which is coated, that you are adding extra barrier that it may take time to dissolve. This polymer, okay, is soluble in HCl, but of course it may need like 10 to 20 minutes to dissolve. So this 10 or 20 minutes are delay for absorption, delay for reaching the site of pharmacological action, delay of the onset of action. So it will take more time, and this will delay the onset of action. So again, coated tablet, we are just adding a polymer that may give a good appearance, may mask the bad taste, may protect the active ingredient during storage, but this barrier will take time to dissolve. Although it is soluble in HCl, but it will take time to dissolve, which will delay the onset of action. The next type is enteric coated tablet. So it's similar, but it is similar as a word, but it is really different. The word enteric coated tablet, it means that this tablet containing the active ingredient and other excipient like lactose is surrounded by certain type of polymer. This polymer cannot dissolve in stomach. It dissolves only in a small intestine. So when the patient take the tablet, inside the stomach it will not dissolve, it will not release any active ingredient, and it will release the active ingredient only in a small intestine. So the active ingredient only will be released in duodenum, jejunum, and ileum, because the polymer will dissolve only at higher pH. The polymer which is covering the tablet cannot dissolve in pH 1.2. It may dissolve only at pH 5 or 6 or 7, which will release the drug at later time. Of course, you may think that this is a disadvantage because it will delay the onset too much, maybe 3 hours or 4 hours, but we don't have any other solution for the drug which is irritant to stomach or unstable in stomach. So if your drug is unstable in HCl and you take it in a normal tablet which dissolves in stomach, the drug will decompose and it will not have any pharmacological effect. And if your drug is irritant to stomach and may lead to peptic ulcer or any type of ulcers, so you have to do that. You have to take it in the form of enteric coated tablet that dissolve only in a small intestine. So there is no direct contact between the active ingredient and stomach, because the active ingredient and the whole tablet is covered by a polymer which is insoluble in stomach. So our next type of tablet is sustained release tablet. The word sustained, it means slow, it means extended. So instead of the patient taking 4 tablets per day, he's taking only 1 tablet per day, which is more convenient, increase the patient compliance. The patient will not forget to take the tablet if it is 1 time per day. So it is very important, this sustained release tablet. And if you want to understand this graph, here there is a time per hour, and here that is the concentration of the drug at different time interval. This white circles, this is the immediate release tablet. The normal tablet is called immediate release tablet. It is not infrared. In pharmaceutics, IR, it means immediate release tablet. So here the patient takes the first tablet. So the tramadol concentration went up very fast and went down also very fast. And after 6 hours, the patient took the next tablet, which increased the drug concentration up and down. After 6 hours more, at time 12 hours from the beginning, the patient will take the third tablet, and then at time 18, the patient will take tablet number 4. So here the patient is taking 4 tablets per day, which is very difficult because now he cannot sleep all the time, the whole day. He has to do much effort to remember and to be awake during this time. So the other solution is to have sustained release tablet. We will take 1 tablet that cover the whole day. But of course, if the patient is taking here 100 milligram in each tablet, in each immediate release tablet, in the sustained release tablet, it should contain 400 milligram. But this 400 milligram are dissolved slowly and slowly throughout the day. If we add 400 milligram in immediate release tablet, the line will go up like that, very high and very low. It may exceed the minimum toxic concentration. During this time, it will have much side effects. But here we are adding 400 milligram in this line. We are adding 400 milligram in the SR tablet, sustained release tablet, but it will be dissolved slowly and slowly till we finish the 24 hours, and that is the idea of sustained release tablet. So the solution here is the slowest step. You can call it the rate limiting step, and you know the slowest step in each series of process is called rate limiting step. We should tell the patient, don't crush the tablet. Don't break it into two halves or several pieces before administration. When you reduce the size of the tablet, it will dissolve faster and it will not give the sustained profile. It will give very fast action, which may be dangerous, because again, this tablet has the same amount of drug as 4 immediate release tablets, for example. Okay, so crushing of the tablet may lead to dose dumping, release of large amount of drug in a small time or in short time, which could be dangerous. That is the definition of dose dumping. So dose dumping, it means we are including the amount of drugs that are supposed to be present in 4 tablets. We are adding 400 milligram instead of 100 milligram, but this 400 should be released in 24 hours. The dose dumping, it means there is a failure in the tablet, failure in the sustainment of the drug. So instead of dissolving in 24 hours, it dissolves in 2 hours. Of course, the curve will go up very fast and it may lead to toxicity. So, of course, like anything, sustained release tablet has advantage and disadvantage. The advantage that it can be used for drugs with short half-life. Short half-life, you know, from pharmacokinetics, that these drugs are excreted from the body very fast. So the patient is supposed to take it so many times, 4 or 5 times per day. So it's better to make it sustained release tablet to increase patient compliance, as we explained before, and also to reduce the variation in the plasma curve. Instead of the plasma concentration of the drug going up and down, sometimes it may go by mistake high, very high. Sometimes it may go below the minimum effective concentration if the patient forget to take any tablet in between. To avoid all that, it is better to take 1 tablet covering the whole day at least. The disadvantage is dose dumping, as we mentioned, failure in the control of the release or dissolution of the active ingredient. So the whole dose will dissolve very fast, which will make toxicity. And of course, it is difficult to make sustained release tablet. You have to add a special type of excipient to bind or to hold the active ingredient. And of course, if you add a special excipient and they are using a special technique of manufacturing, so at the end the tablet will become more expensive. So if you compare, for example, Cataflam immediate release and Cataflam sustained release, you will find that sustained release one is more expensive.